8 symptoms of pancreatic cancer that will shock you. Critical warning signs. Very few people are aware that among all types of malignant neoplasms, pancreatic cancer represents one of the most aggressive and deadly forms in existence. This disease has surpassed even breast and prostate cancers in terms of mortality rates in numerous nations. Yet it remains in the shadows, receiving insufficient media and public attention relative to its growing prevalence. Here's a startling reality. By becoming familiar with some fundamental warning signs, you could have the opportunity to detect this disease in yourself or a family member before it becomes incurable. This cancer is commonly nicknamed the invisible assassin, and such a designation is not coincidental. The 5-year survival rate stands at around 12%, proving skillful at remaining hidden in the body and causing the death of over 65,000 people annually in the United States alone. The most frightening aspect is that approximately 80% of patients don't recognize the first warning bells, considering them negligible disorders or daily inconveniences, until the cancer has reached advanced stages with metastases. However, here's a fundamental element. Current scientific studies demonstrate that many of these indicators begin to present themselves already 3 to 6 months before diagnostic identification, providing a precious opportunity for timely recognition. The pancreas, despite its small size and hidden location in the abdominal depths, performs enormous functions. It contributes to blood sugar control and produces essential enzymes for digestive processes. Due to its concealed position, tumor masses can develop silently without triggering immediate alarms, making recognition of the subtlest indicators even more crucial. In this content, we'll reveal 8 unexpected indicators of pancreatic cancer that you might not imagine, some so common they pass completely unnoticed. And here's the revolutionary element. According to recent scientific research, identifying even just 3 of these signals simultaneously could increase the chances of early diagnosis by nearly 70%. How can such a lethal disease remain so underestimated? Why isn't this information part of daily discussions about health prevention? Let's begin with the first fundamental indicator: digestive system disorders. Pancreatic cancer can severely damage the digestive system through various interconnected mechanisms. The pancreas plays a fundamental role in digestion, generating essential enzymes that facilitate the breakdown of fats, proteins, and carbohydrates into forms the body can absorb. When a tumor mass forms in the pancreas or nearby areas, it can interfere with enzyme production or obstruct the pancreatic duct, triggering a series of digestive problems that can be both bothersome and alarming. With the weakening of the digestive process, food can remain in the stomach without being properly processed, causing continuous nausea, vomiting episodes, abdominal distension, and a general sensation of digestive malaise. Over time, this disruption causes an evident decline in appetite as the body struggles to process nutrients effectively. This frequently leads to involuntary weight loss, muscle mass loss, and nutritional deficits, further compromising the body's resistance. A particularly relevant indicator of compromised digestion is an evident modification in bowel movement appearance. Since the body can no longer properly break down and absorb fats, stools may appear pale, oily, and unusually foul-smelling, a warning signal often underestimated. This isn't simply a digestive disorder, but the method by which the body communicates that something more serious isn't working. Identifying these digestive changes as possible indicators of pancreatic cancer could be decisive. Although they may appear generic or nonspecific initially, understanding the correlation between these symptoms and pancreatic function offers a crucial opportunity for early diagnosis and potentially better therapeutic results. Exhaustion or physical weakness. Pancreatic cancer can rob the body of its energy in a way that far exceeds normal fatigue. It's not the kind of tiredness you experience after an intense day or insufficient rest. It's a deep and continuous prostration that persists regardless of the amount of rest. Even after a full night's sleep, you might wake up feeling as though you haven't rested at all. Within the body, malignant cells compete with healthy ones for energy and nutrients, gradually draining the body's reserves. Simple daily activities like walking, climbing stairs, or lifting light objects can suddenly appear overwhelming, transforming daily life into a continuous battle. But it's not just the physical body that suffers. This physical weakness is often accompanied by emotional difficulties, including feelings of melancholy, restlessness, or irritation. Many people also experience sleep alterations, which only worsen exhaustion and create a vicious cycle of physical and mental stress. What makes this fatigue so insidious is how easily it's confused with stress, aging, or work overload. Unlike normal tiredness, it doesn't diminish with rest or relaxation, but persists and slowly worsens over time. Recognizing this persistent and relentless exhaustion is essential for consulting a doctor promptly, as it could represent one of the few early clues for diagnosing pancreatic cancer. If you find this health information valuable, please subscribe to our channel, hit the like button on this video, and ring the notification bell so you don't miss our upcoming health content that could truly save lives. Fever and chills. Fever and pancreatic cancer often indicate the body's reaction to the inflammatory effects of the disease. When the pancreas becomes inflamed, it activates the immune system's natural defensive mechanisms. These temperature fluctuations can be particularly disorienting because they often alternate. You might experience episodes characterized by intense cold and tremors, followed by periods of high fever. This pattern differs from the constant fever that can manifest with common infections. The combination of jaundice and pancreatic inflammation can create ideal conditions for temperature irregularities. The body is essentially fighting on multiple fronts, dealing with bile duct obstruction, inflammation, and the cancer itself. When they occur, these temperature spikes are often accompanied by night sweats and general malaise. Unlike viral infections that typically resolve within a week, these temperature variations tend to persist or recur. Blood clot formation. One of the most frequently overlooked and underestimated complications of pancreatic cancer is its profound impact on blood coagulation. While many connect cancer to tumor masses or pain, few know that pancreatic cancer can silently create conditions for dangerous blood clot formation. This condition, called hypercoagulability, means blood has a much higher than normal probability of clotting, especially in the deep veins of the lower extremities. Deep vein thrombosis, DVT, is a common consequence, typically manifesting with unexplained swelling in the lower limbs, warmth, pain, and reddish or bluish coloration in the affected area. Although these symptoms may initially appear mild, they conceal a hidden danger. If a portion of the clot breaks away and travels through the bloodstream to the lungs, it can cause a pulmonary embolism, a potentially fatal medical emergency. What makes this process so concerning is the underlying cause. Pancreatic cancer releases inflammatory substances that alter the body's natural coagulation balance, pushing it dangerously toward excessive clot formation. This creates perfect conditions within the body, where clots can develop silently and without warning. The warning signs of pulmonary embolism are unmistakable and should never be overlooked. Sudden difficulty breathing, acute chest pain that intensifies with deep breathing, and accelerated or irregular heartbeat. When these symptoms manifest, immediate emergency intervention is necessary, as just a few minutes can determine the difference between life and death. Understanding the correlation between pancreatic cancer and blood clots can help patients and families stay vigilant, recognizing that sudden swelling or breathing difficulties may be much more serious than they appear, and seeking help without hesitation can save lives. Gallbladder or liver enlargement. When pancreatic cancer develops, it can create a domino effect in surrounding organs, particularly affecting the gallbladder and liver. These changes occur because pancreatic tumors often block the bile duct, the vital channel that carries bile from the liver to the small intestine. The gallbladder, normally the size of a small pear, can enlarge considerably when bile accumulates. This enlargement occurs because the gallbladder continues to store bile, but cannot release it properly due to obstruction. Similarly, the liver might swell due to bile accumulation within it. This swelling can sometimes be felt during a physical examination, presenting as a solid enlargement under the right rib cage. Modern diagnostic techniques, such as CT scans and ultrasound, can clearly reveal these changes. The relationship between these organs is delicate and interconnected. When one system is affected, a domino effect is created that impacts the others. Understanding these connections helps doctors reconstruct the diagnostic puzzle. Healthcare providers often check for these organ alterations during routine examinations, as they can be crucial indicators of underlying pancreatic problems. Gas or abdominal distension. Pancreatic cancer can significantly compromise digestive comfort in ways that many people don't expect or initially recognize. The pancreas plays a key role in producing enzymes that facilitate the breakdown of fats, proteins, and carbohydrates, ensuring regular digestion and nutrient absorption. When a tumor mass develops in the pancreas or nearby areas, it can interfere with this delicate process, causing sensations of unusual fullness and persistent distension. One of the earliest and most significant signs is a sensation of early satiety, the perception of fullness after consuming only a few bites. This happens because the growing tumor can press against nearby structures like the stomach or small intestine, limiting space and altering digestion. Consequently, meals that once seemed normal can suddenly cause distension, tension, or even slight nausea. Unlike typical digestive discomfort due to overeating or mild gastric disturbance, distension associated with pancreatic cancer tends to be persistent and stubborn. It often doesn't improve with common over-the-counter remedies like antacids or dietary modifications. The abdomen may appear notably swollen even on an empty stomach, and the sensation can last throughout the day, making it difficult to ignore over time. What makes these symptoms particularly concerning is how easily they can be ignored or misunderstood. Many individuals think they're dealing with stress, indigestion, or age-related changes, delaying medical consultation. But when the sensation of distension, fullness, or abdominal tension persists for several weeks without clear explanation, it deserves careful consideration and medical evaluation. Recognizing these mild but persistent digestive changes could offer a crucial window for early diagnosis and intervention in a disease that's often identified too late. Abdominal or back pain. The location of pain from pancreatic cancer can reveal crucial information about the tumor's position. When cancer develops in the body or tail of the pancreas, patients often experience a particular type of discomfort that's difficult to ignore. Imagine a dull, persistent pain that seems to come from the depths of the upper abdomen. This pain often radiates toward the back, creating a band-like sensation that crosses the torso. Unlike typical gastric pains, this discomfort tends to intensify after meals or when lying down. The pancreas is embedded in a complex network of nerves and organs. When a tumor mass grows, it can press against surrounding structures, triggering pain signals. Some patients describe it as a sensation of discomfort, while others compare it to strong, constant pressure. The frequency of this pain is significant. Initially, it may present intermittently, allowing periods of relief. However, as the disease progresses, pain often becomes more persistent and intense. Understanding pain characteristics helps doctors distinguish pancreatic cancer from other conditions. The timing, location, and nature of discomfort provide valuable diagnostic clues. Dark urine coloration. Urine color can reveal important information about your health. When pancreatic cancer develops, it often affects the bile duct, causing a condition called jaundice. This occurs when bilirubin, a yellowish compound produced during red blood cell breakdown, accumulates in the body. Normally, bilirubin is processed by the liver and eliminated through stool, giving it its brown color. However, when pancreatic cancer obstructs the bile duct, this system becomes compromised. Even if you maintain adequate hydration, urine might take on a dark yellow or brown shade, similar to the color of cola or strong tea. This change occurs because the body is desperately trying to eliminate excess bilirubin through alternative pathways. Many people ignore this symptom, attributing it to dehydration or dietary changes. However, if this coloration persists for more than a few days despite adequate hydration, it's necessary to consult a doctor immediately. This color alteration often manifests before other visible signs of jaundice, such as yellowing of the skin or eyes. Recognizing this early signal could be fundamental for timely diagnosis. Pancreatic cancer is often silent, but its impact is anything but quiet. What makes it so dangerous isn't just the disease itself, but how easily its symptoms can be ignored, masked as harmless digestive disorders, fatigue, or simple discomforts. Yet, as we've seen, these signals are anything but ordinary. They're your body's silent alarms, trying to communicate that something is wrong. By identifying even just some of these early symptoms, whether it's dark urine, unexplained exhaustion, sudden swelling, or persistent back pain, you could give yourself or a loved one a precious advantage. Time. Time to seek help. Time to act before it's too late. The truth is that knowledge saves lives. Spreading this knowledge can save even more. If this video has helped you understand the hidden signals of pancreatic cancer, imagine how many others could benefit. So please, subscribe to our channel, activate notifications, and help us continue spreading fundamental and potentially life-saving health information. Thank you for following our channel, and remember, your awareness today could mean someone's survival tomorrow. I would love to hear what you think in the comments below. Subscribe to the channel and activate the bell so you don't miss any content, and thanks for watching this video.